Dancer's hip is something I see with a lot of my patients. In fact, with dancers, there's actually a few really common conditions that we treat, usually revolving around the foot and ankle, the knee, or the hip. With the foot and ankle, a lot of times we're looking at Achilles tendonitis or tendinopathy, so that irritation of the Achilles tendon. You start to feel a lot of tightness into the calf and eventually maybe even some pulling into the foot and the plantar fascia. One of the best treatments for Achilles tendonitis or tendinopathy or plantar fasciitis is actually shockwave. So shockwave is a treatment that we use to treat both of those conditions, whether acute or chronic, to help really expedite the healing process. Now, one of the other places we see a lot with dancers is impingement of the hip, or what we like to call dancer's hip. With that hip impingement, we're essentially seeing that femur head, that thigh bone, sitting higher up in the acetabulum, the hip socket, than we normally would, usually just due to that repetitive stress, that jumping, that landing, that compression over time. That can show up as dull or achy pain into the hip or the groin area. It's an incredibly uncomfortable thing to live with. Thankfully, there's a lot of different ways we can treat it, including some distraction of the hip, either manually or with a hip strap, with some adjustive techniques, and then also with some soft tissue therapy and reprogramming of the biomechanics of those inner thighs, glutes, and core muscles. If you're in the San Diego area and you're a dancer, or just someone dealing with those foot and ankle, knee, or hip concerns, come on in, let's get it taken care of and see how we can get you back to feeling your best.